Hi everyone. In this presentation, I will be going over with you the use of virtual reality simulation in nursing education. My name is Adriana Ruiz. Here are the instructional objectives of this presentation. In the interest of time, I will not go over all of them. They're there listed for you, but the most important one is for learners to understand the benefits of using virtual reality simulation in nursing education and the purpose of using virtual reality simulation in nursing education. This is an example of virtual reality simulation being used in nursing education.
What we were involved with today is really exciting. We did a virtual reality where the program allowed us to practice a pap smear, which is a very sensitive procedure and screening that's so important in primary health care.
Many learners across the spectrum, not only in medicine, but especially here in School of Nursing, have similar struggles where they don't get enough patient experience in the sensitive exam, or they feel really nervous prior to performing this exam on a real patient.
The potential for this technology can just really open up a lot of doors for students to get more comfortable and confident in their procedural skills, in their interactions with patients.
So that's a way that we are using virtual reality in nursing education, and it's super cool. This is an online resource for virtual reality use in nursing education. It's called UBSIM, and it's an online resource nurse educators may use to build clinical scenarios. The purpose of using virtual reality simulation is that it allows for nursing students to practice and gain confidence in performing technical skills without the limitations of physical lab availability. And when it's used in nursing education, nursing students may complete a variety of patient scenarios without fearing that they will risk harm to the patient. It also provides nurse educators with a method of providing standardized scenarios in which they may easily monitor a student's performance and progress. We're going to meet societies and professional demands of using virtual reality simulation. We're going to meet a lot of society and professional demands. And one of those is that nursing entering the workforce are going to provide safe patient care. They're going to exhibit confidence in their clinical skills and decision making, and that they're going to possess technological competence. Evidence has proven that including virtual reality as an educational tool prior to clinical preceptorship has had a positive effect in students being prepared to practice in the real world patient setting. A limitation of virtual reality is that we won't be able to meet the competency of interdisciplinary teamwork and collaboration if we only use virtual reality simulations as a teaching method. Accreditation standards met. In terms of accreditation standards, such as the healthcare simulation standards of best practice, the use of virtual reality in nursing education will ensure that high quality learning outcomes are maintained in nursing education. Virtual reality simulations, unfortunately, still lack standardized evaluation tools that are necessary to measure the learning outcomes that are required by accrediting bodies. So a lot of student needs and attributes will be met by using virtual reality. A lot of students nowadays, they value autonomy. So these modules, these scenarios, these clinical scenarios could, be completed on their own, at their own pace. And this is what these types of students might need to develop competence and confidence. In addition, the students, let's say they live in rural areas, in these clinical scenarios, clinical simulation scenarios, they will be faced with patients from diverse backgrounds, which their location, their geographical location of the time may not allow them to reach these types of patients. So they may develop cultural competence by using these virtual reality. Virtual reality, unfortunately, students who don't have means to obtain necessary equipment such as headsets or compatible computers, this will be a problem for them. Evidence also shows that students who are uncomfortable with technology might experience anxiety when using virtual reality simulations. So it's very important for the for the nurse educator to assess how comfortable the student is in using virtual reality simulations. Cultural competence, again, is something that it's increased when we use virtual reality because students are able to have clinical simulation scenarios with diverse populations that they might not be able to see in their real world clinical settings. We've learned that these clinical scenarios allow for students to learn about cultural variability and cultural sensitivity. And they've been effective in promoting students' perceived clinical and cultural competence. Limitations of virtual reality simulations might be that virtual reality still fails to lack fidelity. It still lacks fidelity. And fidelity is the degree to which the experience resembles reality. There's an example of virtual reality being used to increase cultural competence. It's called SimCare, and it's a virtual reality simulation program designed with the specific objective of helping students improve cultural competence. In terms of enhancing cognitive, psychomotor, and affective domains, virtual reality really has an upper hand. Virtual reality, in terms of the psychomotor, students are able to practice certain tasks such as medication administration without risk of harming the patient. In the cognitive domain, they're able to develop higher order cognitive skills such as critical thinking. And then in the affective domain, students are super satisfied with using virtual reality as a learning tool, and they show improved confidence and they're more emotionally engaged. Learning outcomes obtained using virtual reality include supporting skill building, expanding knowledge, boosting student confidence, and cultivating deeper empathy. Virtual reality directly supports domain 5 of the AAC Essentials, which values quality care and reducing patient harm through proficient individual performance. So right now, the virtual reality as a technological tool is being of great benefit to the Generation Z nursing students, because Generation Z, they're visual, they're interactive, and they're technologically oriented learners. And this aligns with their learning preferences. So this generation has demonstrated positive outcomes in improving knowledge retention, stronger clinical reasoning, and higher student satisfaction following the use of virtual reality simulation. And we also meet employer demands because we're graduating nurses who are safe and competent. Measurable virtual reality objectives. So a lot of objectives can be met by using virtual reality. And one objective could be medication administration. So in the clinical simulated scenario, the nurse would practice medication administration steps, and the virtual reality platform would give us a log of how the nurse completed these steps. If the steps were completed satisfactorily, then the student would be successfully progressing toward terminal program outcomes such as patient safety and competency. The philosophical framework for virtual reality is constructivism, which states that learners will gain knowledge through active participation rather than passive methods. So I would advocate for virtual reality simulation to be used in nursing curriculum in many different ways, but some of them would be that I would, one, offer it as a solution to undergraduate programs which suffer from limited clinical placement sites. Two, I would, demonstrates the positive effects of using VR to increase cultural competence. And I would, three, advocate for using it to faculty members, as virtual reality permits nurse educators to remotely monitor student progress. There's many places we could use virtual reality and specific nursing areas. For example, one of them is in the pediatric world. We could use virtual reality simulation in a lab to practice initiating safety interventions in a pediatric patient suffering from a seizure. So faculty members using virtual reality will have to obtain comprehensive training in using the virtual reality, which will include setting up the virtual reality, curriculum integration, issues related to accessibility and equity. They could get this training through independent learning modules. Once they get this training, they'll be able to help students with connectivity issues. They also nurse educators must receive training in adapting grading rubrics for the use of virtual reality, and IT support could be also implemented into nursing schools for students having issues with their virtual reality use. And lastly, Kurt Lewin developed the change theory to promote changes in healthcare. And we could use this theory to implement the use of virtual reality in nursing schools. In the unfreezing stage, I would, present information to nurse educators on the gaps that we have in nursing education due to limited clinical placement sites. During the change stage, I would make workshops available to faculty so that they could practice using the virtual simulations, because once they become experts in using the virtual reality simulations, then they can transfer this knowledge to the students, and the students then will have increased knowledge as well. And in the refreezing stage, I would integrate virtual reality simulation into the course requirements. So these are all my references. I thank you all for joining this presentation, and I hope that virtual reality simulations is something that is implemented more into nursing curriculum. Thanks, guys.